And that brings us nicely on to question 6, which is from chapter 7. And this is now about a little bit more on what you've sort of talked about with regards to pain triggers. But just could you explain a little bit more about why it's important to remove that cause and remove that pain trigger?
Yes. When a person has a sore knee or they've stubbed their toe and they keep stubbing their toe is going to remain highly sensitized. Why would someone take a painful back and start giving it exercise and expecting it to desensitize? So the important first step is to do the assessment and understand the pain triggers. Then stop hammering the pain trigger. And that's where we remove the cause of the pain and allow it to settle. So if it happens to be that when they bend forward and no one's pointed out to them that, you know, the way they put their socks on and tie their shoes in the morning sensitizes their back for the rest of the day. And of course, we've documented that mechanism. Stover Snook, who was a professor with the Liberty Mutual Insurance Company in New England in the States, they are obviously trying to remove people from the back pain insurance list. And they took that mechanism and trialed it and found that when people stopped heavy bending, and some people even pull their knees to their chest first thing in the morning, not realizing that they do get a bit of pain relief by triggering the stretch reflex, but not realizing that they just tenderized that pain trigger to be more sensitive for the rest of the day. But when he trialed it on groups of people, it was found to be an effective strategy to help wind down their pain triggers. So there's just an example from the mundane, but I can then use examples from high-performance athletics. You may be, or your listeners may be familiar with jiu-jitsu and mixed martial arts and that kind of thing, where we've been able to restore some high-profile jiu-jitsu careers. These are people who do a lot of heavy bending. And some of them would get up in the morning and force their palms flat on the floor, not realizing that they thought they had to do that to keep the hip and spine flexibility to perform their athleticism, but they were so painful and highly triggered that they couldn't train. So we stopped that as the pain sensitizer and said, just keep that athleticism for the octagon or the training mats, but for the rest of the day, be quite pristine. And we were able to salvage a few careers by giving them pain-free training capacity by avoiding the cause. And then, of course, slowly over time, it settled and away they went. But those are flexion examples. We could go through the same thing in extension or compression or shear or whatever it is. And I'm going to mention one other thing, Chris. There will be people who do not respond to different motions, postures, and loads. Those are the red flags. We've found very sinister causes of people's back pains who didn't respond to changes in posture. And they had a lung embolism or an aortic aneurysm, or they might have had a cancerous tumor, all things that went unflagged. Even though they'd been screened for them, they were never found. But we found them because the people didn't respond to removing the mechanical cause of their pain. Anyway, we can talk about the psychology of that as well if you wish.
By all means, go for it.
Well, there are trends now where it's becoming more popular for clinicians to believe that telling people the pain is in their head is useful. The most movement-fearing patients we get are those that have been told the pain is in their head. And it usually comes from clinicians who were either incompetent and didn't administer a assessment of their pain triggers, or they didn't know how. So they blame the patient for their pain and say, look, the pain's in your head, just get on with it. Well, not really. These are very solid citizens, some of these folks. And I'll give you one example. A fella comes in and he says the pain clinic says the pain is in my head, and if it's in my head, it means I'm crazy. But I really think it's in my back and in my hamstring. He described it as shards of glass cutting open his hamstrings when he moved his back a certain way. And it turned out he had a nerve trap, which once he understood that, he was able to mitigate the cause quite quickly. But he was on the brink of suicide. He said, if the pain's in my head, I'm crazy. I don't deserve to live. And I said, sir, give me a week. And we were able to show him how to stop the cause. All the fear and anxiety went away. So this is a trend. It will die. But for now, there's too many telling patients that the pain is in their head. It may be exaggerated, perhaps, by certain personality profiles. But once again, when you empower the person to know what's causing their pain so they can control it, it's so interesting. A lot of the associated psychological distress will disappear.